and gentlemen. Correlation of meiboscale, symptom score, and sign score for primary meibomian gland dysfunction in India's eyes, a cross-section study, no financial disclosures. So meibomian gland disease, or MGD, is characterized by terminal duct obstruction and changes in the glandular secretion. It is the most common association of dry eye disease, and there are certain risk factors known for MGD. There are several grading scales available for MGD, but they are very cumbersome. There is significant inter-observer variability leading to greater variation, and OSDI evaluation, ocular surface disease index, the 6 MGD sign scores, and the improved MEBO scales are means of assessment, but there is non-availability of a validated MGD scale suited for the Indian outpatient setting, which is a gap in the present knowledge. So although the three systems can help in grading, there is no evidence that there's a correlation between them, and evaluation of the correlation will help us analyze whether the improved MEBO scale used alone can determine the severity of MGD, or a combination of the grading systems is needed. To the best of the author's knowledge, such a study to correlate meibomian gland loss scores as per the improved MEBO scale has not been conducted. So this was a hospital-based cross-sectional study from October 2019 to 2020 in Uttarakhand, approved by the Institutional Ethics Committee in patients with primary meibomian gland disease. All participants filled the OSDI form, completed the ocular examination by expert ophthalmologist, and early margin examination was done during the slit lamp, by which the MGD sign score was calculated. Infrared imaging of the upper and lower eyelids was done using a specular microscope, and the areas were visually assessed and compared to the photographic card, which is the improved meiboscale photographic card. So OSDI was calculated as per protocol. MGD sign score was calculated as per the sum of the 6 grading systems, which is mentioned here. And the MGL score was basically a visual comparison between the standard photographs as described by PULT. So on the right, you have the MGD meiboscale, the MGD meibomian gland loss assessment. On the left, this is how it appears on the specular microscope. In the center, you have the slit lamp photographs. A sample of 124 eyelids was calculated to be compared, and appropriate statistical tests were used. The Spearman's correlation coefficient was used, and greater than 0.5 was considered clinically significant. The Jonquier-Tubbs-Strutt JT test was applied to evaluate the distribution of varying ordinal scores, and the R effect was used to calculate the effect size. So 68 Indian subjects and 212 eyelids were assessed. There were 29 males and 24 females, and the mean age was 57 years. This is the scatter diagram showing the comparison of OSDI MGD sign score and OSDI and the meibomian gland loss, or the MGL score. These were not clinically significant. However, the comparison of MGL score with MGD sign score showed strong correlation, which was statistically significant, and the correlation coefficient of 0.83 was clinically significant. So the JT test applied to the MGD sign score was statistically significant and found a large JT statistic with a large effect size of 0.93. So the study evaluated validated symptom score, validated sign score, and the improved meiboscale, and the clinical utility of photographically aided scales such as the meiboscale is poorly studied in literature. The existing basis, which is the study by Arita et al., utilizes both biomicroscopy and meibography for the interpretation, which is cumbersome. The visual scale, the MEBO scale, comprises of just a picture card, which allows the observer to assign a score based on the patient's observation of the meibomian gland morphology. Linear regression analysis correlates it well with OSDI. However, this is not possible in the clinical setting. The sum of both eyelids has been studied. The scores of both eyelids has been studied by Wang et al., but this was correlated with the speed questionnaire. The percentage total area as calculated by computer software is also possible. However, this is costly and not available widely. Robin et al. Have compared the meibomian gland loss compared to the OSDI, but they did not correlate the two parameters as to what is the correlation. Brooks and Gupta have shown the initial presenting meiboscale score in patients of refractive surgery, but they have not provided details about those with pre-existing MGD. As per our findings, the meiboscale alone can be used for reliable assessment and grading of the MGD. Given the large sample size, the results are externally generalizable. However, we still recommend independent symptom assessment through OSDI. There are certain limitations of the study as to the inability to examine the association between the parameters considered and other factors, the effect of recall bias, and there is scope for further studies as well. However, to conclude, in Indian subjects in the outpatient setting, meiboscale alone can be used for reliable assessment and grading of primary MGD, as the score so obtained has clinical utility similar to the sum of 6 sign scores. We still recommend independent symptom assessment through OSDI or a similar questionnaire for dry eye in all patients, as the meiboscale has poor clinical utility in predicting the symptoms. Thank you.
Was your what? What was the why did you do this study? What is the usefulness of the study?
So, sir, the clinical assessment of meibomian gland disease is quite variable as per the inter-observer variability that is there. There is no standard that is used across institutions, across.
What did you, how did you standardize this?
So the standardization is basically on the visual assessment of the direct observation of the meibomian glands on specular microscope or any other comparable
That is
infrared
the only
camera.
test you had. Was this thing?
Pardon, sir?
Did you study the lipid layer, the aqueous layer, the other layers of the tear film, or we just based it on these
Just
photographs?
based on the meibomian gland only, sir. The other parameters were well correlated with this. As per the study by Arita et al., the existing science scores, which are too many science scores that are currently used, all of them are well correlated with just the observation that we have made on the photographic card.
So what would you suggest should be the way forward for people to assess dry eye? For instance, if I have a machine, what should I assess as a very conclusive evidence of dry eye?
For meibomian gland disease, only the meibomian gland disease part of it, sir, I would recommend that currently the slit lamp examination be extended and an instrument that is available in the OPD like an autorefractor or specular microscope be used to visualize the meibomian gland morphology directly under infrared imaging and the morphology that is observed be compared to the meiboscale card that is freely available on the internet, and only that is sufficient. It is well correlated with everything that is being currently used to grade MGD.
Okay, thank you. Because today the MGD or the dry eye has become a sort of a fashionable entity now, in the sense that people, the amount of investment in the MGD machines is, so if there's something so basic can come to a conclusion that you can treat patients on this basis, then it would be really worthwhile, because people are spending thousands and lakhs of rupees on these machines to come to a conclusion whether a patient has dry eye or not.
Actually, sir, we were also surprised to see the correlation coefficient of 0.83. We were very particular on establishing what is the weak correlation, what is the moderate correlation, and what is the strong correlation. We went back to the scientific and statistical literature to find out whether such a limit has been defined. And anything above 0.8 is strongly correlated and is clinically significant. So this study actually has the potential to change the practice, because the large sample size and the clinically significant correlation coefficient are sufficient to, for a person to extend the study further and rather propose a guideline according to this.
Thank you.
Thank you so much, sir. Thank you.
Thank you, Dr. Prateek.